See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on the nurses addressing today's most challenging healthcare problems, and never has that light been so bright. As the entire world adapts to a global pandemic and responds to the massive disruption in our lives and our learning, it has challenged nurses to rapidly rethink and redesign how we take care of our communities and every member in them. Over the next few weeks, See You Now is bringing you stories from the nurses in the midst of the coronavirus pandemic who are finding new and novel ways in real time to care for all of us. Across the world, students of all ages, along with educators and families, are part of an unanticipated global homeschooling moment introduced by COVID-19. While necessary to ensure public safety during a pandemic, closing schools temporarily and indefinitely is a difficult decision that has far-reaching implications for students' health, their learning, and their safety. No one is more attuned to those needs and complexities than teachers and school nurses who, on any given day, are helping medically fragile and special needs students and students who struggle with anxiety, depression, and trauma, and housing and food insecurity. In this episode, we virtually visit Camden, New Jersey, one of the pandemic's hardest hit areas, to meet veteran school nurse Robin Cogan and learn how school nurses are caring for students and families while schools are closed.
Thinking about being in school in January and February compared to now feels like it was a completely different world. My name is Robin Cogan. I am a school nurse in Camden, New Jersey. I also teach school nursing at Rutgers Camden, and I write a blog called The Relentless School Nurse to amplify the voice of nursing. I think about back in our classrooms. In fact, the last day we were there, I was in tears. The kids were not there that day. The classrooms were so vibrant and beautiful, filled with our artwork, colorful. The fish in the blue room, the new pet fish was just sitting in his bowl looking around. There was nobody in the room. In another room, there was a preschool teacher who was doing this activity with butterflies, and the chrysalis were forming and the monarchs were going to be released. I mean, there's these rhythms and things that you do in school that all of a sudden were completely shut down. And I just remember feeling like we're walking through an unknown door, and what I'm seeing is the past, and I don't know what the future is going to look like. In school nursing specifically, it has changed dramatically over the 19 years that I've been a school nurse. And in most recent years, the mental health challenges have become a primary concern. I don't even know what it's going to feel like returning to school after this. We're all going to have our own sense of PTSD around this event. There was a lot of uncertainty in terms of the closing of school. Nobody really knew what it meant. And as a school nurse, we were not part of the closing, the design of it. It was clear that our voice was not included. And that cannot happen with reentry. We have to help design what needs to happen, because within the school community, those most essential pieces of especially working with children who are medically fragile, working with special needs children, working with children that we know struggle with issues with anxiety and depression, can often be left out of these conversations of how to manage a school closing. It's not a one-size-fits-all. We actually have students from age 3, preschool, to age 21 if they have special needs. They're in school until they're 21. And school nurses are responsible on the population health level of a school and on the individual level as well, and everything that runs in between. I would be responsible for visitors in the building, for parents, certainly for staff, and always for children. And school nurses are involved in every single part of what you can imagine it takes to keep a child safe and healthy and ready to learn. And that is a daunting task in today's world. But I have to say there are school nurses all over the country doing tremendous work. I just read about a group this morning in San Antonio that started a hotline for parents to call in to answer health and wellness questions. There are school nurses that are doing the contact tracing through their local health department. School nurses are manning some of the testing sites. Some school nurses have returned back to their previous jobs in the acute care setting. There's a medical service corps that school nurses have signed up for. So the need is great. And I know in my school district, we're making face masks for healthcare providers. We've taped books and provided them to teachers. We've also Skyped into classes that have been going on just to say hi and to connect and do check-ins with people. So there's a lot of collaboration happening. There's a lot of unknown down the road, and trying to plan for the unknown is probably the most difficult part of this. It's going to be interesting when we go back, because I feel like the role of the school nurse has changed dramatically in the last few months in a very positive way through a very traumatic time.
According to UNESCO, it's estimated that across the globe, more than 1.5 billion students, that's 90% of the world's learners, are at home due to school closures in about 190 countries. As educators scramble to put coursework online to teach young people remotely, school nurses fear the coronavirus crisis is amplifying health and educational inequalities that can persist for a lifetime. Partnered with teachers and coaches and counselors, there are remarkable stories of school nurses driving through their neighborhoods to deliver lunches, celebrate a birthday, or virtually visit a class to say hello and let students know how much they are treasured and missed. Schools help instill routine and coping mechanisms for students, and school nurses are talking with families about the psychological toll prolonged school closures might have on young learners. A loss of predictability, routine, rhythm, and social play affects the emotional well-being of the most vulnerable children, and they are the ones experiencing this pandemic the hardest. All children, but particularly those with special education needs, really struggle with disruptions to their schedules, to their sleep, and their ability to socialize, which then impacts their cognitive, social, and language development. While urgent action to close schools prevented school nurses' involvement in the closure planning, school nurses are busy designing our return. What does physical distancing in the classroom and on the playground look like? What are the hand and face hygiene habits, mask-wearing practices, pickup and drop-off routines, breakfast and lunch etiquette, sports and recreation activities, school hours, split schedules to reduce the number of students on any given day? So much to consider and plan for. As Robin said, we don't know what reentry will look like, but one thing is certain: school nurses will be some of our very best teachers. For See You Now, I'm Shauna Butler. And if you're enjoying and caring about these stories, please subscribe and share with a friend so we can reach millions across the planet with a warm smile.
Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.